Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video we can see important and previous year questions for staff nurse exam preparation. Here we are preparing questions for RRB staff nurse exam, also ESIC, DSSSB, AIIMS, NORCET, DME, Kerala PSC exam, also JPHN exam, Insurance Medical Service exam. Let's see the questions. First question, hardening of the renal arteries are called. Options: option A, nephrosclerosis, option B, nephritis, option C, arteriosis, option D, atherosclerosis. Here the question is hardening of the renal arteries are called. Hardening of the arteries or hardening or thickening of the arteries are called atherosclerosis. Okay, here it is renal arteries. Renal means it is related to kidney. So it will come nephrosclerosis. Option A is the correct answer. Hardening of the renal arteries are called nephrosclerosis. Option A is the correct answer. And the next question, bleeding time range in Duke's method is. Options: option A 30 seconds to 1 minute, option B 1 to 3 minutes, option C 2 to 5 minutes, and option D 3 to 7 minutes. Bleeding time in Duke's method, it is 1 to 3 minutes. There are two methods there to assess the bleeding time, and first one is Duke's method. In this the bleeding time is 1 to 3 minutes. And the second method is IV method. In this the bleeding time, normal bleeding time is 2 to 9 minutes. And the next question, composition of blood transfusion to hemophilia patient is. Options: option A plasma, option B packed cells, option C cryoprecipitate, option D platelet. Among this, which composition of blood will administer to hemophilic patient? It is cryoprecipitate. Option C is the correct answer. Cryoprecipitate, which is preparing from the plasma, and it contains fibrinogen and blood clotting factors. Hemophilia means it's a bleeding disorder in which the patient body lacks sufficient amount of clotting factors. So the cryoprecipitate, which is preparing from the plasma, and it contains fibrinogen and clotting factors, especially factor 8, and factor 8 is anti-hemophilic factor, and factor 13, that is fibrin stabilizing factor. And the next question, hemophilia B is caused by lack of clotting factor. Options: option A 7, 8, factor 8, option C factor 9, and option D factor 10. Hemophilia A and hemophilia B is there. Hemophilia A is caused by lack of clotting factor 8. That is hemophilia A. And hemophilia B is caused by lack of clotting factor 9. Okay, here answer will come option C, clotting factor 9, hemophilia B. Clotting factor 8 is anti-hemophilic factor A, and clotting factor 9 is Christmas factor or plasma thromboplastin component or anti-hemophilic factor B. The next question, Warfarin should be withheld dash hours before any invasive procedures. Options: option A 6 hours, option B 12 hours, option C 18 hours, option D 24 hours. And the correct answer is option D 24 hours. Warfarin should be withheld 24 hours before any invasive procedure because there is a risk of bleeding tendencies. And the next question, in which of the following condition blood transfusion is contraindicated? Options: option A bleeding hemorrhoids, option B hemorrhage, option C congestive heart failure, option D hemophilia. Blood transfusion is not given in case of congestive heart failure. Option C is the correct answer. Other bleeding hemorrhoids, hemorrhage, hemophilia, all case we can administer transfusion. We can do blood transfusion, but in case of congestive heart failure, we are not usually given blood transfusion as the pumping effect of the heart is reduced. In that situation, if we are administering blood transfusion, again there will be fluid overload. So usually In case of congestive heart failure, blood transfusion will not prefer. And the next question, during blood transfusion, single donor can donate dash ml of blood. Options, option A 100 to 200 ml, option B 200 to 250 ml, option C 250 to 350 ml, option D 350 to 450 ml. One donor can donate 350 to 450 ml. Option D is the correct answer. And the next question, type of blood products that can be prepared from 1 unit of blood is. Options, option A packed red cells, option B platelet concentrate, option C fresh plasma, option D all of this. And the correct answer is option D, all of this. 1 unit blood contain about 350 to 450 ml. From 1 unit of blood we can prepare packed RBCs, platelet concentrate, fresh plasma. All we can prepare from 1 unit of blood. And the next question, platelets can be stored at. Options, option A 20 to 24 degrees Celsius for 5 days, option B 20 to 24 degrees Celsius for 9 days, option C 4 to 8 degrees Celsius for 5 days, option D 4 to 8 degrees Celsius for 9 days. Platelets can be stored at 20 to 24 degrees Celsius for 5 days. Option A is the correct answer. And the next question, iron chelating agent is. Options, option A charcoal, option B deferoxamine, option D calcium gluconate, option D alum. And the correct answer is, it is deferoxamine, which helps to remove the extra iron from the body. It is a chelating agent. Iron chelating agent is deferoxamine. Option B is the correct answer.